Lyme disease in dogs, causes, treatment, and prevention. Lyme disease is one of the most prevalent tick-borne diseases in the United States, affecting thousands of dogs each year. This bacterial infection, caused by Borrelia burgdorferi, is transmitted primarily by ticks. While many dogs infected with Lyme disease may not show immediate signs, the condition can lead to severe health issues such as arthritis, kidney disease, neurological disorders, and heart complications. Early detection and treatment are crucial to minimize long-term damage, but fortunately, there are several ways to protect your dog from this potentially dangerous disease. What is Lyme disease? Lyme disease is an infectious disease caused by the bacterium Borrelia burgdorferi. It spreads through the bite of an infected tick, particularly the black-legged tick, Ixodes scapularis, in the eastern and northeastern United States. When a tick carrying the bacterium attaches to a dog and feeds on its blood, the bacteria enter the dog's body. These bacteria then spread through the bloodstream and often settle in the joints, leading to inflammation known as Lyme arthritis. If left untreated, the infection can affect other organs, such as the kidneys, nervous system, and heart. Although Lyme disease is found in almost all states in the U.S., it is most common in the Northeast, Midwest, and parts of the West Coast. However, not all ticks carry the Lyme disease bacteria. The primary carriers of the disease are the black-legged ticks and western black-legged ticks, which thrive in wooded and grassy areas. Symptoms of Lyme disease in dogs. One of the most challenging aspects of Lyme disease is that its symptoms are not always immediately obvious, and many dogs infected with the bacterium do not show symptoms at all. Studies suggest that only 5 to 10% of dogs with Lyme disease will exhibit noticeable symptoms. These symptoms may appear anywhere from 2 to 5 months after infection, although in some cases, they may take even longer to manifest. The symptoms of Lyme disease in dogs are varied and can be vague. If your dog shows signs of illness and has had exposure to a tick-prone environment, it's important to consult with the veterinarian for a proper diagnosis. Even if your dog has not shown symptoms, it is still wise to seek veterinary advice, especially if it has been in an area with a high tick population. Below are some of the most common symptoms associated with Lyme disease in dogs. 1. Fever. A fever is one of the first signs that your dog may be infected with Lyme disease. You might notice that your dog is shaking, and its body temperature may be higher than normal. Affected areas such as the ears, paws, and belly may feel warm to the touch. 2. Loss of appetite, lethargy, and weight loss. Lyme disease can cause a decrease in appetite and general lethargy, making your dog less active than usual. If your dog has stopped eating and is losing weight, this could be a sign that the infection has started to affect other organs, such as the kidneys. 3. Swollen and painful joints or lymph nodes. As Lyme disease causes inflammation in the joints, your dog may experience pain and stiffness. The affected joints may feel warm or swollen. Additionally, lymph nodes, which are responsible for filtering harmful substances, may become enlarged and painful to the touch. 4. Limping. Swelling and pain in the joints may result in limping, often affecting one or more limbs. The limping may appear intermittently, and your dog may alternate which leg it favors. Causes of Lyme disease in dogs. The cause of Lyme disease is the Borrelia burgdorferi bacteria, which is transmitted to dogs through the bite of an infected tick. However, certain environmental and lifestyle factors can increase the likelihood of infection. 1. Tick bites. A tick must bite and feed on an infected animal, typically a small mammal like a mouse, in order to contract the Borrelia bacteria. Afterward, the tick can transfer the bacteria to your dog when it attaches to feed. It usually takes about 36 to 48 hours of feeding before the tick is capable of transmitting the bacteria. Therefore, timely removal of ticks is critical in preventing Lyme disease. 2. Environment. Ticks are more common in areas with dense vegetation, such as forests, tall grasses, and brush. These regions are especially abundant in the Northeast, Northwest, and upper Midwest regions of the United States. Ticks thrive in environments with temperatures above 45 degrees Fahrenheit, 7 degrees Celsius, and humidity levels greater than 85%, so areas that meet these conditions are more likely to harbor ticks. 3. Lifestyle. Dogs that spend a lot of time outdoors, especially in areas where ticks are prevalent, are at a higher risk of contracting Lyme disease. Active dogs, particularly those that enjoy hiking or running through wooded areas, are more likely to encounter infected ticks. Diagnosing Lyme disease in dogs. A tick must remain attached to your dog for at least 36 to 48 hours before it can transmit Borrelia bacteria. For this reason, removing ticks as soon as possible after exposure is vital. Diagnosing Lyme disease in dogs requires a combination of clinical signs, medical history, and diagnostic tests. There is no single test that can definitively diagnose Lyme disease. However, veterinarians can use blood tests to detect the presence of Borrelia burgdorferi antibodies, indicating that the dog has been exposed to the bacteria. Keep in mind, though, that a positive result does not necessarily mean that the dog has Lyme disease. It simply shows exposure to the bacterium. To confirm the diagnosis, the veterinarian may conduct additional tests, such as blood and urine analysis, X-rays, and joint fluid analysis, to rule out other conditions and assess whether the bacteria have affected the dog's kidneys, joints, or other organs. Treatment of Lyme disease in dogs. Dogs diagnosed with Lyme disease are typically treated with antibiotics for several weeks. Most dogs begin to show improvement in their symptoms shortly after starting treatment. However, while antibiotics can alleviate the symptoms, they may not entirely eradicate the bacteria. In severe cases, especially when Lyme disease has affected the kidneys, nervous system, or heart, more specialized care may be required. For dogs with kidney complications, extended courses of antibiotics may be necessary, along with additional medications and supportive therapies. If Lyme disease has caused neurological or cardiac issues, referral to a veterinary specialist may be needed for advanced treatment and management. Prognosis for dogs with Lyme disease. The prognosis for a dog diagnosed with Lyme disease largely depends on how quickly treatment is administered. If the disease is detected early and successfully treated, the outlook is generally favorable. However, if Lyme disease remains untreated and progresses to affect the kidneys, heart, or nervous system, the prognosis becomes more guarded. In untreated cases, Lyme disease can lead to kidney failure, which may manifest as vomiting, excessive thirst, and increased urination. Dogs with kidney failure often face a poor prognosis and may require euthanasia. Even if symptoms such as fever, loss of appetite, and joint pain resolve with treatment, some dogs may continue to suffer from chronic Lyme arthritis. Additionally, dogs that have had Lyme disease may be at an increased risk of developing chronic kidney disease later in life. Preventing Lyme disease in dogs. Preventing Lyme disease in dogs revolves primarily around controlling tick exposure. Regularly check your dog for ticks, especially after outdoor activities, and remove any ticks promptly. This is particularly important during peak tick seasons, spring and fall, and after your dog has been in areas where ticks are known to thrive. Keeping your yard well maintained by trimming grass and shrubs can reduce tick habitats around your home. If you live in an area with a high tick population, you may want to treat your yard with tick-killing products. There are also several preventive products available, such as tick collars, topical treatments, and oral medications. These products can help protect your dog from tick bites and Lyme disease. Consult your veterinarian about the best tick prevention options for your dog's lifestyle and environment. For dogs living in high-risk areas, some veterinarians may recommend a Lyme disease vaccine. While this vaccine does not offer complete protection, it can reduce the likelihood of severe infection. The vaccine is typically administered at 12 weeks of age, with a booster shot 2 to 4 weeks later, and then yearly before the tick season. Conclusion. Lyme disease is a serious, but preventable, condition for dogs. By taking proactive steps such as regular tick checks, using tick prevention products, and maintaining a clean and tick-free environment, you can significantly reduce your dog's risk of contracting this disease. If you suspect your dog may have Lyme disease, seek veterinary care as soon as possible for diagnosis and treatment. Early intervention can help ensure that your dog leads a healthy and active life.